I'll turn it over.
Thank you. Thank you so much, Congressman. So we're here because we feel as though the American people have not heard from all the expertise that's out there all across our country. We do have some experts speaking, but there's lots and lots of experts across the country. So some of us decided to get together. We're America's frontline doctors. We're here only to help American patients and the American nation heal. We have a lot of information to share. Americans are riveted and captured by fear at the moment. We are not held down by the virus as much as we're being held down by the spider web of fear. That spider web is all around us, and it's constricting us, and it's draining the lifeblood of the American people, American society, and American economy. This does not make sense. COVID-19 is a virus that exists in essentially two phases. There's the early phase disease and there's the late phase disease. In the early phase, either before you get the virus or early when you've gotten the virus, if you've gotten the virus, there's treatment. That's what we're here to tell you. We're going to talk about that this afternoon. You can find it on America's Frontline Doctors. There's many other sites that are streaming it live on Facebook. But we implore you to hear this because this message has been silenced. There are many thousands of physicians who have been silenced from telling the American people the good news about the situation, that we can manage the virus carefully and intelligently, but we cannot live with this spider web of fear that's constricting our country. So we're going to hear now from various physicians. Some are going to talk to you about what the lockdown has done to young, to older, to businesses, to the economy, and how we can get ourselves out of the cycle of fear. Dr. Hamilton.
Thank you, Simone, and thank you all for being here today. I'm Dr. Bob Hamilton. I'm a pediatrician from Santa Monica, California. I've been in private practice there for 36 years. And today I have good news for you. The good news is that children, as a general rule, are taking this virus very, very well. Few are getting infected. Those who are getting infected are being hospitalized in low numbers. And fortunately, the mortality rate of children is about 1/5 of 1%. So kids are tolerating the infection very frequently. They're actually asymptomatic. I also want to say that children are not the drivers of this pandemic. People were worried about initially if children were going to actually be the ones to push the infection along. The very opposite is happening. Kids are tolerating it very well. They're not passing it on to their parents. They're not passing it on to their teachers. Dr. Mark Woolhouse from Scotland, who is a pediatric infectious disease specialist and epidemiologist, said the following. He said, there has not been one documented case of COVID being transferred from a student to a teacher in the world. I think that is important that all of us who are here today realize that our kids are not really the ones who are driving the infection. It is being driven by older individuals. And yes, we can send the kids back to school, I think, without fear. And this is the big issue right now, as Congressman Norman alluded to. This is the really important thing we need to do. We need to normalize the lives of our children. How do we do that? We do that by getting them back in the classroom. And the good news is they're not driving this infection at all. Yes, we can use security measures. Yes, we can be careful. I'm all for that. We all are. But I think the important thing is we need to not act out of fear. We need to act out of science. We need to do it. We need to get it done. Finally, the barrier, and I hate to say this, but the barrier to getting our kids back in school is not going to be the science. It's going to be the national unions, the teachers union, the National Education Association, other groups who are going to demand money. And listen, I think that it's fine to give people money for PPE and different things in the classroom, but some of their demands are really ridiculous. They're talking about, where I'm from in California, the UTLA, which is the United Teachers of Los Angeles, is demanding that we defund the police. What does that have to do with education? They're demanding that they stop or they shut all private charter schools, privately funded charter schools. These are the schools that are actually getting the kids educated. So clearly there are going to be barriers. The barriers will not be science. There will not be barriers for the sake of the children. It's going to be for the sake of the adults, the teachers, and everybody else, and for the union. So that's where we need to focus our efforts and fight back. So thank you all for being here, and let's get our kids back in school.
Hello, I'm Dr. Stella Emanuel. I'm a primary care physician in Houston, Texas. You know, I actually went to medical school in West Africa, Nigeria, where I took care of malaria patients, treated them with hydroxychloroquine and stuff like that. So I'm actually used to these medications. I'm here because I have personally treated over 350 patients with COVID. Patients that have diabetes, patients that have high blood pressure, patients that have asthma, old people. I think my oldest patient is 92, 87-year-olds. And the result has been the same. I put them on hydroxychloroquine, I put them on zinc, I put them on Zitromax, and they are all well. For the past few months, I've taken care of over 350 patients. We've not lost one. Not a diabetic, not a somebody with high blood pressure, not somebody with asthma, not an old person. We've not lost one patient. And on top of that, I've put myself, my staff, and many doctors that I know on hydroxychloroquine for prevention, because by the very mechanism of action, it works early and as a prophylaxis. We see patients, 10 to 15 COVID patients every day. We give them breathing treatments. We only wear surgical masks. None of us has gotten sick. It works. So right now, I came here to Washington, D.C. to say, America, nobody needs to die. The study that made me start using hydroxychloroquine was a study that they did under the NIH in 2005. That say it works. Recently, I was doing some research about a patient that had hiccups, and I found out that they even did a recent study in the NIH, which is our National Institute, that is the National NIH, National Institute of Health. They actually had a study, and go look it up. Type hiccups and COVID, you will see it. They treated a patient that had hiccups with hydroxychloroquine, and it proved that COVID is a symptom of hiccups. It's a symptom of COVID. So if the NIH knows that treating the patient with hydroxychloroquine proves that hiccup is a symptom of COVID, then they definitely know that hydroxychloroquine works. I'm upset. Why I'm upset is that I see people that cannot breathe. I see parents walk in, I see diabetics sit in my office knowing that this is a death sentence and they can't breathe. And I hug them and I tell them it's going to be okay, you're going to live. And we treat them and they live. None has died. So if some fake science, some person sponsored by all these fake pharma companies comes out and say, oh, we've done studies and they found out that it doesn't work, I can tell you categorically it's fake science. I want to know who is sponsoring that study. I want to know who is behind it. Because there is no way I can treat 350 patients and counting and nobody is dead and they all did better. And then you're going to tell me that you treated 20 people, 40 people and it didn't work. I'm a true testimony. So I came here to Washington, D.C. to tell America, nobody needs to get sick. This virus has a cure. It is called hydroxychloroquine, zinc, and Zitromax. I know people want to talk about mask. Hello, you don't need mask. There is a cure. I know they don't want to open schools. No, you don't need people to be locked down. There is prevention and there is a cure. And let me tell you something. All you fake doctors out there that tell me, oh yeah, I want a double-blinded studies. I just tell you, quit sounding like a computer, double-blinded. I don't know whether your chips are malfunctioning, but I'm a real doctor. I have radiologists, we have plastic surgeons, we have neurosurgeons like Sanjay Gupta saying, oh yeah, it doesn't work and it causes heart disease. Let me ask you, Dr. Sanjay Gupta, hear me. Have you ever seen a COVID patient? Have you ever treated anybody with hydroxychloroquine and they died from heart disease? When you do, come and talk to me. Because I sit down in my clinic every day and I see these patients walk in every day, scared to death. I see people driving 2-3 hours to my clinic because some ER doctor is scared of the Texas board or they are scared of something and they will not prescribe medication to these people. I tell all of you doctors that are sitting down and watching Americans die, you're like the good Nazis, the good Germans that watch Jews get killed and you did not speak up. If they come after me, they threaten me. They've threatened to, I've gotten all kinds of threats. Oh, they're going to report me to the boards. I say, you know what? I don't care. I'm not going to let Americans die. And if this is the mountain, if this is the hill where I get nailed on, I will get nailed on it. I don't care. You can report me to the board, you can kill me, you can do whatever, but I'm not going to let Americans die. And today I'm here to say it, that America, there is a cure for COVID. All this foolishness does not need to happen. There is a cure for COVID. There is a cure for COVID. It's called hydroxychloroquine, it's called zinc, it's called Zithromax. And it is time for the grassroots to wake up and say, no, we're not going to take this any longer. We're not going to die. Because let me tell you something. When somebody is dead, they are dead. They're not coming back tomorrow to have an argument. They're not coming back tomorrow to discuss the double-blinded study and the data. All of you doctors that are waiting for data, if 6 months down the line you actually found out that this data shows that this medication works, how about your patients that have died? You want a double-blinded study where people are dying? It's unethical. So, guys, we don't need to die. There is a cure for COVID.
Oh my God. Dr. Emmanuel, also known as Warrior. Before I introduce the next guest, I just want to say that I wish all doctors that are listening to this bring that kind of passion to their patients. And the study that Dr. Emmanuel was referring to is in virology, which talks about a SARS viral epidemic that affects the lungs that came from China. And they didn't know what would work. The study showed that chloroquine would work. It sounds exactly like it could have been written 3 months ago. But in fact, that study in virology, which was published by the NIH, the National Institute of Health, when Dr. Anthony Fauci was the director, again, the official publication of the NIH, virology, 15 years ago, showed that chloroquine, we use hydroxychloroquine, it's the same, a little safer, works. They proved this 15 years ago when we got this novel coronavirus, which is not that novel. It's 78% similar to the prior version, the COVID-1. Not surprisingly, it works. I'm now going to introduce our next speaker. Sorry, I forgot to say your name.
It's all right. Dr. Dan Erickson. Dr. Gold asked me to talk about the lockdowns, how effective they were, and do they cause anything non-financial? They always talk about the financial, but you have to realize that lockdowns, we haven't taken a $21 trillion economy and locked it down. So when you lock it down, it causes public health issues. Our suicide hotlines are up 600%. Our spousal abuse, different areas of alcoholism are all on the rise. These are public health problems from a financial lockdown. So we have to be clear on that fact that it's not like you just lock it down and have consequences to people's jobs. They also have consequences, health consequences at home. So we're talking about having a little more of a measured approach, a consistent approach. If we have another spike, coming in cold and flu season, let's do something that's sustainable. What's sustainable? Well, we can socially distance and wear some masks, but we can also open the schools and open businesses. So this measured approach I'm talking about isn't made up. It's going on in Sweden. And their deaths are about 564 per million. UK full lockdown, 600 deaths per million. So we're seeing that the lockdowns aren't decreasing significantly the amount of deaths per million. Some of their Nordic neighbors have less deaths for a variety of reasons I don't have time to go into today. So what my quick message here in a minute or two is just that we need to take an approach that's sustainable. A sustainable approach is slowing things down, opening up schools, opening up businesses, and then we can allow the people to have their independence and their personal responsibility to choose to wear masks and socially distance, as opposed to putting edicts on them, controlling them. Let's empower them with data and let them study what other countries have done and make their own decision. That's what I'd like to share. Thank you.
Are there any questions?
Are there any questions?
Who are you guys? We are so excited. Well, I'm from South Dakota. You might have.
Yes. Yes. So
I'm so glad you guys are preaching this message.
South Dakota did something interesting. It's interesting that you're from there. So the governor did not restrict access to hydroxychloroquine.
We know. We took
Right.
a lot of flack for that.
Right. And you were, I believe you were the only state in the union that did that. And there's been studies out there that attempt to show that it doesn't work, they're inaccurate because they're given at the wrong time.